Well, good evening, distinguished guests, colleagues, students, and friends. Welcome to a journey in public service with Dr. Anthony Fauci and Christopher King. My name is Jennifer Bui. I'm the chair for Department of Global Health of Georgetown University's School of Health. And it's my great pleasure to introduce the event. Tonight, we are honored to bring together two remarkable leaders in public health and health delivery, healthcare. Dr. Christopher King, the inaugural dean of Georgetown University's School of Health, and Dr. Anthony Fauci, who has an extraordinary legacy as one of our country's leading doctor, scientist, and dedicated public administrator. Only yesterday, I was working with our students in epidemiology and reading one of Dr. Fauci's critical editorial titled COVID-19, Navigating the Uncharted. It was published in March 2020 in New England Journal of Medicine, at a time that we are all facing this unprecedented pandemic of our modern era. This represents just one of the many challenges that Dr. Fauci has led our country's responses. To our audience here in Gaston Hall, and I know there are about more than 200 virtual participants from all over the world, welcome to this important dialogue. You are sure to be inspired. The School of Health at Georgetown University proudly sponsored tonight's event. Our school serves as a collaborative hub for scholars and students to work cross disciplines to address human health through multiple lenses, through healthcare delivery and policy, to global health development, to advance health human sciences. Our mission is clear: to advance health and well-being through innovative research, interdisciplinary education, and transformative engagement with communities. Our vision is for a just and equitable world where all people can achieve optimal health. This evening's program will start with a 40-minute dialogue between our two speakers, followed by 15 minutes Q&A sessions. To ensure a good experience for all of us, I kindly request that you silence your phone. So it is now my great pleasure to welcome Dr. King and Dr. Fauci to the stage. Dr. King will facilitate the Q&A session after the conversation. All right? Let's wait a couple minutes.
Thank you. Oh, God. It's good to see everyone. Good afternoon. Good afternoon. And welcome to our attendees who are with us virtually. I think we have about 200 folks joining us virtually. Dr. Fauci, it's a pleasure to be with you again.
Yeah, good to be with you.
Thank you, thank you. Why don't we start? I'm just interested. I know we're 2 weeks into the new year. How did you spend your holiday season?
Okay. Very quietly with my daughters and their partners in my home, just a few blocks north of here, with my wife, Christine, and our daughters, which they live in different parts of the country, so it was a great treat when they come in, one in San Francisco, one in Boston, and one who used to be in New Orleans but is now in Virginia, so it was really pleasant.
And speaking of Christine, I'd like to welcome Christine. It's so good to see you. Dr. Brady. Well, let me tell you how I spent my holiday. I spent my holiday finishing this book, How many of you have read On Call? All right. You have homework, all right? You have homework. I highly, highly recommend that you read this. You will be inspired and enlightened by Dr. Fauci's journey. So, let's start from the beginning. You start off in the book talking about your early childhood, Eugenia and Stephen, your parents. Tell us a little bit about your early upbringing and how your parents really provided you with the nuts and bolts to be the Dr. Fauci that we know so well today.
Well, it was easy to analyze many years later about the impact of, what the theme of your home and your parents were. But when I was going through it, I didn't realize it. But retrospectively, my father was a pharmacist. We lived in a working class neighborhood of Brooklyn, New York. Where's everybody from Brooklyn? Anybody from Brooklyn in the audience? You can't tell from listening to my accent that I'm from Brooklyn. And he owned a small pharmacy, and it was very, very different than what we think about pharmacies today, where you have almost an industrial type of an approach with the big chain stores of Walgreens and CVS. The pharmacy in a working class neighborhood in the middle of the Bensonhurst section of Brooklyn was the hub for caring for people. I mean, he not only, filling prescriptions was a relatively almost tangential thing of what he did. It was mostly, he was the psychiatrist for people with troubled marriages, with delinquent kids, which we had a lot in that neighborhood, with people who needed advice about where they wanted to go to school, and who really needed somebody to talk to. It was a very, I think, ineffective business model. He cared very little about finances. And when I went back in my mind and analyzed it, he just cared about the neighborhood, the community. And I grew up, from the time I was a child, I used to deliver prescriptions on my Schwinn bike around the neighborhood. And I used to help behind the counter sometimes in the weekends and the evenings and sometimes in the summer, that the attitude of what's really important is taking care of people, not necessarily making a profit from them. So the idea of public service was ingrained in me right from the beginning, which was kind of a jump start for my education formally when I went to Our Lady of Guadalupe Elementary School and the tough love of the nuns, and then I went to a Jesuit high school and a Jesuit college, where the thought of service to others dominated. And I didn't realize it until I retrospectively analyzed it, that started off with me when I was 5, 6, 7, 8 years old, well before I went to a Jesuit school.
And welcome back. Welcome back. Welcome back. So your parents met, I believe, in 8th grade?
Yeah, that was...
Wow.
My mother and father, my grandparents came over from Italy at the 1903 and settled in the Little Italy section of Lower Manhattan, for those of people familiar with Manhattan. And then my father was born there, and my grandparents on my mother and father's side both came over from Italy, landed in Ellis Island, and then settled in downtown Manhattan. My mother and father were born, didn't know each other then, but both families moved to the Bensonhurst section of Brooklyn. And my mother and father went to the same elementary school, and we have notes from my mother and father when they were in the 8th grade.
Wow.
Saying, boy, you're the person I want to ultimately marry. Like, really?
Wow. Wow.
Look around, Dad.
Well, we're thankful for that.
I'm very thankful
for that.
And then they both went to New Utrecht High School, which is a public school in Bensonhurst, and they got married immediately after they graduated. My father was 18, my mother was 19. They got married right away. My father went off to Columbia and went to Columbia College of Pharmacy, and my mother went to Hunter College, and that was it.
That was it.
That was it.
Well, you know, many of the young people know your work through COVID, right? But before COVID, there was HIV. So let's reflect back to that time period, the early 1980s, another novel virus, right? And we just didn't know what was happening. It was, you know, gay community initially, and it was, and you were interested in doing work in this space, but many of your colleagues at the time were telling you, no, don't do this, don't do this. It could be career suicide. Focus your energy in other places. But you stood your ground, right, and you said, nope, this is where I'm supposed to be. How did you know that was your calling?
You know, I just felt it. It was a gut feeling. I had been, I did my medical training in New York, internship, residency, and chief residency. I did a fellowship at the NIH. And from 1972, when I came back from my medical training, the last chief residency, which was like after 7 years of training, I had a very successful career from 1972 to 1981, mostly because I had a very generous mentor who put me on a very hot project that was high risk, but if the results were good, they were groundbreaking. And fortunately for me, you know, I always say, I think I'm pretty good, but I was also lucky and had a great mentor, that we developed therapies for formerly fatal inflammatory diseases that had 100% mortality, this inflammatory autoimmune vasculitides. And we developed a therapy that was very, I would say, provocative, and we used low doses of drugs that they give for cancer, which actually changed the whole field. Right. So at a precociously young age, you know, 30, 31, I got to be really quite well known in the field. This is 9 years before HIV. So my career trajectory was going like this. So after we made these groundbreaking observations, everything after that we did it in 1970, 71, 72, 73, 74. Then when we got to around 79 and 80 and 81, it was more just derivatives of what the groundbreaking thing was. Right. So I was kind of looking for something a little bit different. And then when the first cases of what turned out to be HIV became apparent, of 5 young, curiously gay men from LA who presented with a pneumonia that you only see if you're immunocompromised. I have to be honest with you, Christopher, I thought that was a fluke. And I said, well, you know, it's kind of interesting, but it's probably going to go away. And then 1 month later, in July of 1981, another report from the CDC, instead of 5 men, there were 26, curiously all young, otherwise healthy gay men who were seriously ill and dying in New York, San Francisco, and LA. And it was at that point that I had this overwhelming feeling that I have to, this is a challenge I can't walk away from. And that's when my mentors were saying, well, your career trajectory is like this. Right. And why don't you, you know, what are you doing changing? I just changed the direction of my career. Turned it around and said, from now on, I'm going to admit these desperately ill mostly gay men, a few injection drug users. And I did that, but it was before the disease had a name. Right. It was inappropriately called gay-related immunodeficiency or gay cancer or gay plague. Right. And we didn't know what the etiology was. So it was a very intense and almost surrealistic period in my professional career where you were taking care of desperately ill people and you didn't even know what the etiology, but you knew it was an infection and you knew it was spread epidemiologically very, very effectively among the young gay population, mostly in the big cities, but really everywhere. And I felt 2 things. I felt an intellectual challenge that I was trained as an infectious disease person. I was trained as an immunologist, and I was a very good clinician. So I said, you know, I really want to take care of these people at the same time as studying the disease. And I also had this feeling of of profound empathy for people who were already somewhat disenfranchised because of the stigma associated with LGBTQ at the time. Remember, you're talking 40 some odd years ago. Together with the fact that they had a terrible illness that was killing them. So I just felt I have to do this. And that's when I got involved full time in that.
Some of the core competencies that we teach at the School of Health is the importance of humility and really humbling yourself when you go into targeted communities. And you did a great job at that, right? Talk a little bit about how you situated yourself in the gay community, the activists that were influential in your learning curve, and how those relationships helped accelerate the HIV research agenda.
Well, I will, and I'll try to be succinct about it, but it's a very, I think, critical story when you compare it with the pushback we're getting today against science, where the pushback we were getting from the gay community, people say, well, isn't the same? They were saying, you're a government person, you're a terrible person, you're not listening to us, and people are saying that. Now, it's like, it isn't even apples and oranges, it's peanuts and watermelons different. It really is very different. And the issue was that the scientific community and the regulatory community, understandably, were very rigid, because for other diseases that weren't as cataclysmic or acute or mysterious as HIV, if you're trying to develop new drugs for hypertension or new drugs for diabetes or whatever, these were diseases in which there were a lot of other drugs. And they would say, well, it would take 7 years to approve a drug. That wasn't so bad, because you had 5 other drugs. We had no drugs. And there was inclusion and exclusion criteria in the clinical trial. So what the fundamentally gay population was saying was, we want a say in the scientific agenda, because we're the ones that are living with this disease or at risk for this disease. And the rigidity of the regulatory process is incompatible with a disease that once you get clinical illness, you'll die 12 months later. This was before any drugs. So they wanted a seat at the table to talk to us. And most of us, including me, but very temporarily, were saying, well, wait a minute. When I say this, it almost gives me heartburn. We're the scientists. We know what's best for you. And they would say, to hell with that.
No.
We really want to have some input. That's when they started demonstrating. They were provocative, iconoclastic, theatrical. And since I was a very visible figure, because I was one of the few people that was actually studying HIV, and I happened to be someone who worked for the federal government. So I became the face of the federal government. So they figured, who else to aim their howitzers at? And they did it to me. And probably one of the best things that I've done in my professional career is, instead of doing what most of the scientific and regulatory community was doing, running away from them, like, these guys are crazy. What are you doing? They're demonstrating, they're closing down Wall Street and invading St. Patrick's Cathedral. So I said to myself, let me put aside just the theatrics, the iconoclastic behavior, and listen to what they were saying. And when I was listening to what they were saying, they were making perfect sense. And I said to myself, if I were in their shoes, I would be doing exactly what they were doing. And that's when I did something that shocked them. When they were demonstrating, instead of telling the police to arrest them, which everybody else was doing, I was saying, let's sit down with them and see what they have to say. That began a relationship that didn't turn all of a sudden rosy overnight, by no means. But it went from, antagonism to talking to each other, to cooperating with each other, to collaborating with each other, to the point where they became a very important part of the decision-making, a very important part of what kind of trials were designed. And now, 40 plus years later, some of them are still my very close friends.
And I know that some of them, you know, because of the profound sense of urgency, even though they had befriended you and had a relationship with you, would publicly disparage your name, right? Because they were, people were just angry, right? And so you were able to forgive and show compassion.
Yeah.
And it's again, this wasn't your first time at the rodeo, right? I mean, you've had these moments, and I just think that's really inspiring. How do you do that?
You know, Christopher, you used the word forgive.
Yeah.
And I wouldn't even use that word because they didn't do anything wrong to be forgiven. So it was rather than say forgive them, I felt, since I would probably be doing what you were doing if I were in your shoes, I felt an affinity to them. So it was a strange, my staff at the time, which, you know, they were not in lockstep with me, they didn't like the idea about allowing non-scientists into the scientific circle. And I, you know, had to do something about that.
Yeah.
But to me, it was almost identifying more with them rather than forgiving them. Yeah. And you know, one of the most iconoclastic of them was Larry Kramer, a very famous playwright, you know, the leader of Gay Men's Health Crisis and the originator and the beginning head of ACT UP New York, which then spread throughout the country. Boy, he and I, he used to jump all over me like you wouldn't believe. Even when we were finally agreeing on things, he would get up and we would be on television together. He'd be yelling at me saying, oh, you're terrible and this and that. The government's not doing enough. You got to lock yourself to the gate of the White House fence. And I would say, Larry, you can't do that. The last time you'd ever get near the White House. But at the end of it, he and I became very, very close. Very close.
Yeah, you know, I think about, you know, leadership and how surrounding ourselves with people who have gifts and expertise that we don't have is a hallmark of effective leadership. And there's several moving points and moments in the book, and I want to reflect, and Dr. Grady, I know you will appreciate this, your friendship with Jim Hill, who was a colleague who turned friend and became a member of your family. Can you introduce the audience to Jim Hill? I just want to lift up his name because he was so influential in your evolution.
The Jim Hill chapter, I think, is an important chapter in the book. Not only because he turned out to be a dear friend, and as you said, a member of the family, very close to Christine and I, the godfather of one of our children, is that he manifested what it was like to be a gay man in the government at a time when being a member of the LGBTQ community was not as well accepted as it is today. And he was a brilliant guy, a scientist, who I befriended early on. And then when I became director of the Institute in 1984, I wanted him to be my deputy. And it's very interesting. I loved the guy. And he still said, you know, I'm hesitant now because I don't know whether you know, but I wouldn't be hurt if you decided you didn't want to take me as your deputy because, you know, I'm gay. I said, Jim, I knew you were gay the minute I looked at you. You know, what are you talking about? This good-looking, perfectly groomed guy, you know, like, really? So that's when our relationship really got really close. But a very poignant part about it, again, that drew us closer was he was in a study. You know, I write it in the book that if you're paying attention to the time, it should be a red flag. He was stationed in the Navy in San Francisco in the 70s, okay?
Wow.
And he was a gay guy in San Francisco in the 70s. You know, he was stationed on Angel Island, but he used to hang around the Castro district, which became a disaster for the number of people that were infected. He got in a study at the NIH for hepatitis, because many young gay men had hepatitis B. And he gave his blood to the person who was running the study before the HIV tests were available. Oh. So he was being followed for hepatitis. When the HIV test became available in 1985, which remember now I've been director for a year,
right.
and he's, you know, my deputy. Right. So he came into my office one day and very, very distraught. And he said, I'm gonna have to resign. And I says, what are you talking about, resign? You know, I love the guy. And he was very competent. Mm-hmm. And he said, I just found out that I'm positive for HIV, and I don't want it to be an embarrassment to you how stupid it is that a guy who was the deputy director of the Institute was stupid enough to get infected. And I says, oh, Jim, lose that right now. And he was so relieved that I wasn't. And the reason I tell the story is that he was, you know, kind of representative of what was going on then, where people were afraid to tell their parents that they were sick and dying because they didn't want their parents to know they were gay. So that essentially got us closer, really, really close. And he was with me right until the time he died. And he was really, he still is among the people that I love the most.
I can tell. So I want to talk about the moment you had to tell the president no. There was a time when President Bush sought you out for director of the NIH, but you respectfully and assertively again stood your ground and said, no, this is not for me. Why did you say no, and do you have any regrets?
I have absolutely no regrets. And I said no because as much as the director of NIH is a fabulous job, I thought it would take me another step far removed from what my core competence of what I love to do, seeing patients, taking care of patients, and running a big research institution, NIAID, which was responsible for all AIDS research and all other infectious diseases, malaria, tuberculosis. And I thought if I would take the job as NIH director, as great a job as that is, I would sort of step into a level of administration where I would be responsible for every institute, where, you know, I would be the nominal leader of that, but you're not. The leader is the one who's in the trenches where I was. And President George H.W. Bush really wanted me. I became very good friends with him, and I write a chapter in the book about him, and I think it's a very good example of how I loved him as much as I loved Obama and Biden. So it isn't as if it's Democrat versus Republican. He was a conservative Republican, but he was just an incredibly good person. And he wanted very much for me to be the director of NIAID. And I tell a funny story in the book in that he called up Lou Sullivan, who was the HHS secretary, and said, you know, Lou, I want Tony Fauci to be director of NIAID, you know, offer him the job and have him come. So Lou comes to me and says, do you want to be the director of NIAID? I said, no, I don't want to be the director of NIAID. And he said, well, the president asked me to ask you. And I said, I don't want to be. And he was great, Lou. And he said, well, listen, I'm not going to tell him no. You're going to tell him no. So he called me down, and I went to HHS building, and I remember very clearly we were in the car driving to the White House, and he said, Tony, really? You're going to say no? And I says, Lou, don't put me in this position. I'm going to say no. So we go into the Oval Office, and John Sununu, who was the chief of staff, leads me into the Oval Office, sits down with the president, who I knew quite well, because Chris and I got to know him when he was vice president, and he was kind enough to invite us to a bunch of social functions to the vice president's mansion. So I knew him pretty well. Yeah. So we sat down and he offers me the job. And I just said, Mr. President, please listen to what I'm saying. I think I could serve you and the country much, much better if I stay in my current position. And he stopped for a moment, and it felt like 10 minutes. Yeah. It was 15 seconds. And he looked at me and he said, you know, I respected you a lot before, and now I respect you even more now. Wow. So why don't you go ahead and continue to do what you're doing? The funny part of it is that we were walking out of the Oval Office. John Sununu puts his arm around me with a terrible smile on his face. He says, you son of a bitch, nobody says no to the president.
Right. Wow. So it's 7 administrations, is that right? You've served 7 administrations, and you have to have tough skin, obviously, we know that. But, I think about your time with the Trump administration, and that has to be one of the most salient moments for you and your ability to persevere and really, really be a consummate professional, right? How were you able to do that? I would look at those press conferences, and many of you looked at the press conferences, and you'd see Dr. Fauci and Dr. Burr, and I'm just like sweating bullets on your behalf, right? So how did you navigate that time?
Well, again, I described it, and I'll be really, really quick on this, is that the first time I went into the White House to brief President Reagan, a very good friend of mine who knows the White House scene, he spent 6 years in the Nixon White House, and he was a very good friend and was at HHS at the time. And when he heard I was going to brief President Reagan, he said, I just have a little bit of advice for you. And I said to myself years later, I would have hoped that I would have come to that conclusion anyway, but his advice helped me. He said, when you go into the White House and you go under that awning of the lower level of the West Wing, whisper into your own ear, this may be the last time I'm ever going to come into this building because I might have to tell the president, the vice president, or the people around them an inconvenient truth that they may not want to hear. And then you may not get asked back again. Right. But there's such an aura of I've been in the White House hundreds of times now. 1 year with President Trump and 2 years with President Biden. And it's just a very heady feeling, and you kind of like to get asked back. But he said, don't ever be afraid to tell somebody something as long as it's the truth, because they will respect you or they will not get asked back. And I did that with Reagan, with George H.W. Bush, with Clinton. I had to tell them things that, based on my knowledge as a scientist, this is what we should be doing, and maybe we're not doing it totally. And they all did it in a way that said, that's great, we respect you, fine. What happened with COVID, which was a very charged situation, is that when the president, and I had a very good relationship. People out there think that we're enemies. I had a very good relationship with President Trump. He kind of respected what I was doing, but when he started to say things that were not true, like the virus is going to disappear like magic, or these magical elixirs that people are talking about, hydroxychloroquine and ivermectin, work, when I knew as a scientist, not only did they not work, but they were actually could be harmful. Right. So I felt that I had a responsibility for my own personal integrity, but more important, to the American people who I served, that I had to do something which was profoundly uncomfortable for me. Right. And that was to contradict the President of the United States publicly. And what some people don't fully appreciate, that I do describe in the book, the president himself was less upset at that than the staff around him, who really got upset that I had the temerity to say something publicly that was against the president. And that's when they started this disinformation, discrediting campaign, which goes to this day.
So you learned about the efficacy of I'm bringing us up to COVID now, of the vaccine at 90%, right, efficacy, which is pretty remarkable for a vaccine. You were having a glass of wine. I think you were outside with you and Dr. Grady. Red or white? What's your preference? Red or white wine?
I was drinking Pinot Grigio.
You were drinking Pinot Grigio. I'm a Pinot Noir guy. But you got the call from your colleague at Pfizer, and I wrote it down. You said, what an amazing trip my life has been, as you sipped on that glass of wine. Tell us about that moment. I think you were approaching you were a few weeks from your 80th birthday, right? When you got that call. So that had to be a moment for you.
Well, it was an incredible moment because, we had done something that was unprecedented, that we got a trial going and we had the results that were going to come out in less than a year. Yeah. If you put that in the context of most vaccines, it takes 7 to 10 years. Mm-hmm. So if it would have taken 7 to 10 years, millions more people would have died. Right. So we were hoping at best that we would get a 50 to 60% effective vaccine. Because remember, influenza vaccines on a good year are 60% effective. Right. On a bad year, 10% effective. So we were hoping, A, that it would be effective, because it was a brand new platform, this mRNA. Right. And we were hoping 50%, but if we're really lucky and God is good to us, we'll go to 65, 70%. So we were having dinner in this pod. My next door neighbor and I, and Chris and his wife would get together and have dinner outside, freezing. I know a lot of people did that. We were sitting down having dinner with a fire with our gloves on. Right. I'm drinking a glass of Pinot Grigio with a glove on. And in the middle of the dinner, my phone rings, and I picked it up. I look, it's Albert Bourla, the CEO of Pfizer. So I said, wow, I got to take this. So I walked outside and went out into the walkway out onto the street. And I didn't know what to expect. And he said, Tony, are you sitting down? And I said, oh, shit. There's going to be bad news. And he said, you're not going to believe this, but the vaccine is more than 90% effective. Right. And when he said that, I just was breathless. I just couldn't believe it. I said, oh my God, I can't believe that it's this good. And it turned out when they analyzed the data, it was 95% effective. And then a week later, the Moderna came out, and that was 93% effective. So I got to tell you, I came back and I was on the verge of tears, of both shock in a positive sense and happiness that, oh my God, now we're turning this around. Because as you remember, up to that point, we were having 5,000 deaths a day, which is the reason why we had 1.2 million total deaths.
Yeah, wow. We're getting close to our 5-minute mark, but we can't have this conversation without talking about family.
Right.
And acknowledging, your wonderful wife, and you have 3 daughters, Jenny, Megan, and Allie, and you have a new granddaughter, Lena. How's she doing?
Great.
How's she doing? How did you manage? Is there such thing as work-life balance?
Yeah.
How would you grade yourself as husband or dad, now granddad, as you reflect on your time in public service?
Well, I have to be very honest and say that for the younger people in the audience, I am not the poster child for a good work-life balance, but I'm extremely lucky. Mm-hmm. And I'm lucky because I have a support system, predominantly with Christine and the girls, who were just absolutely an essential part of my survival, was to have people who would, encourage you to continue to do the work, not get you to feel guilty about all the hours you spend and to unconditionally love you. There no tension about that. You know, it's just really, I wish that everybody has that. Yeah. I'm very lucky to have Christine and the kids.
You have a beautiful, beautiful family, beautiful family. So I am glad, and I know I'm speaking on behalf of my colleagues and the students here at Georgetown, that you've chosen us for this next phase of your magnificent life. And since we have a lot of students with us today, and we talk about, this is Georgetown, so everything is around purpose and service and justice, right? And how do we use our lives to make the world a better place? And so in the lessons that you've learned over the years, what type of wisdom would you like to share with this audience today? Many of whom are interested in careers in healthcare or public health.
Well, you're training at an institution that, as I described in my own training, is as good academically as anywhere, but the core of what this institution about is service for others, of making the world a better place and not making it all about you, but what you can do. So my feeling has always been that pick out something that you can be passionate about, number one. Right. It may not be as apparent to you when you're trying to think about what it is. Right. So I wouldn't get discouraged and saying, you know, I'm going through my education, but I'm not really, really excited about any one thing. I wasn't at the time when I was training in medicine. It was only circumstances that were put in front of me. So it would be A, continue along the theme of service to others. Number two, figure something out ultimately that you're passionate about. Right. And remember one lesson that I learned, that most of the time, successful careers are not necessarily linear. Right. And I tell that story that when I was training in medicine, my firm desire was to go back from my fellowship at the NIH and practice medicine on First Avenue and 71st Street in Manhattan. Yeah. That's what I wanted to do. And it was only when I got exposed to the concept of research where what you could do would not only be good for your individual patient, but what you learned could also be used and have a multiplier effect for other physicians, nurses, and healthcare providers to learn from what you did and proving something that works as a therapy or what have you. So don't be disappointed as if you're pointed in this direction and then all of a sudden something really turns you on and you go this way. It's all going to be this way, but it may be this. And not strictly linear.
It's a journey, Do you all hear that? All right? It's not always going to be a linear experience. It's okay. So, you know, our students are very, very ambitious, and things have to go a certain way, and when things don't happen the way that they anticipated, it's traumatic, right? And so calm down, calm down. Remember, follow your heart. I love the experience around telling President Bush no, because you knew what you were good at, what you were passionate about, and what was most important to you, and you knew that that's how you could serve the country best, right? And so that's a perfect example. So why don't we, I think we're at the 6:15 mark, and there's some folks who really want to ask you some questions, and I think we have a mic in the center. We're going to ask you to if you go around and then come to the center and line up. That's how we're going to do this. So questions for Dr. Fauci? Come on, really, this is your moment. This is your moment. And I'm going to ask you to make your questions brief so we can get as many in as possible. And you could start by just telling us your name and if you're a student, what you're studying.
Hi, my name's Catherine. I'm a student in the School of Foreign Service, probably studying STIA. I was wondering how you were able to, I guess, stick to your morals while you were doing something you're passionate about, such as AIDS, even when others are going to talk at you and decry you for doing this.
Yeah, I mean, it's a good question, and it's a very important question. You know, I focus on what my goal is and what my purpose and what my end point is. And if you have enough confidence in what you're doing is the right thing, those other things that go on are really peripheral noise that you shouldn't let distract you or veer you off from the course that you're doing. It's an interesting question because in those early years, people that I respected didn't really want me to go into HIV/AIDS, and some of them actually didn't want to have anything to do with the gay community. Right. And I had to make some tough decisions about essentially telling them that you're not going to be around very long if you keep that attitude up. So just focus on what your goal is, and everything else will fall into place.
Thanks for your question. Next.
Hello, Dr. Fauci. It is truly an honor to meet you tonight. I'm Chuck Rapani. I'm a freshman in the School of Foreign Service, also thinking about STIA as a major. My question was, between your experience between HIV and the COVID-19 pandemic, communication was one thing that, in my opinion, the government was not necessarily successful at. In your experience, what was the problem with communicating to the public, and how can improvements be made to make communication more effective for future health crises?
Yeah, a simple question, but a complicated answer because things changed significantly from the 1980s and 90s to 2022, 3, 4, 5, and that is the introduction of information, disinformation and misinformation that is amplified by social media. And in the arena of a society that is profoundly divisive. So that's not an excuse for some of the missteps in communication because none of us were perfect in trying to communicate a moving target. One of the issues that I think we have to do better at, if there's going to be a lesson to be learned about how we prepare for the next pandemic and respond from the standpoint of the context of communication, is that we've got to be very, very clear to get people, and sometimes maybe science literacy and critical thinking, which is the reason why I love being here at Georgetown, is that you're being taught critical thinking. And what's going on right now in information dissemination is what I see as a disturbing level of lack of critical thinking, where people get into a silo, they keep hearing the same thing, and social media, which we didn't have back in the day of HIV, in the peak of it, there were some denialists who were saying that HIV didn't cause AIDS, but it was a relatively small group that didn't have the facility of social media to spread it out so well, so that people who were telling the truth could easily overcome them. Right now, as I've said, that we're living in an arena of the normalization of untruths. And we've really got to be really careful about that, because if saying something that's untrue is normalized, then nobody knows what's true. And it becomes really difficult to communicate, particularly when you're dealing with a moving target like COVID, which was very different what we knew in January of 2020 to what we started to know in February and then March and then April, and all of the things that changed that the public easily, if you really want to be anti-science, would say, scientists have no idea what they're talking about. They keep changing their mind. No, science is a process that gathers information, data, and evidence so that you can then make a decision at the moment that you're required to make a decision. But science is a self-correcting process, so that if the months go by, but the information changes, if you're true to the science, you will then gather the information and say, now the situation has changed. And that's exactly what happened with wear masks, don't wear masks, get vaccinated. You know, those are the kind of things that if somebody really wants to be a disinformation purveyor, you could have a field day with that, which is exactly what's going on with the spread of misinformation and disinformation. And quite frankly, I think the idea that we're now going to pull out all fact-checking is going to make it even worse. Sorry, it was a longer answer than you wanted.
Next question.
Hi, Dr. Fauci. Thank you for all that you do. I'm getting my master's through the School of Medicine, and my name is Diari Bektiar. My question for you, I'll try and keep it short, is how do you find such power and strength to be such a loud, powerful voice when you have groups and patients that are almost voiceless at times?
I didn't hear the last part. When you have
patients that are almost voiceless at times.
You know, it's almost the same answer to one of the first questions, is that when you're dealing in a very, very charged situation, you've got to dig deep down in yourself and say, what is the correct, proper, right, ethical, scientifically based thing to do? And then that becomes clarity. And when that clarity is there, the other stuff is noise. And you know, it's noise on both sides, because if you get completely put aback by criticisms, you're going to get distracted. If you get absorbed with all the praise and adulation, you're going to get distracted. So put them aside and focus like a laser on what you're doing, and it's not that difficult. It really isn't.
Thank you.
Good evening. My name is Toby, and I'm a freshman in the college studying math. And earlier you spoke about how with the AIDS epidemic, you needed to find a way to bring gay people to have a seat at the table in discussing their health outcomes and how they are responding and interacting with both the administrative and medical profession as well as the disease. And my question is that right now we still see disparate health outcomes in terms of gender as well as race. And I was wondering how you think we should be working to rectify that and just change the field in that way.
Yeah, I mean, you're talking about ingrained reasons for disparities in health and in accessibility. I think that we have to realize it is still a serious problem. And the social determinants of health, particularly in minority populations, is something that you can do a little bit about immediately, but you have to have a decades-long commitment to overcome that, because social determinants of health that are associated with all the reasons why minority populations, African Americans, Hispanics, do much worse in every element. When you look at HIV/AIDS, the access to care, the access to prevention modalities is much, much less. You know, if I was able to show slides, I could show you slides of the accessibility of pre-exposure prophylaxis among whites is like this, among Hispanics is like this, and among African Americans is like that. And we're dealing, you know, we're in 2025 right now, so we have to keep pushing that as an agenda that we can't walk away from. The same thing with the accessibility of women, particularly African American women, to care. It's really something that is a problem that we can't deny is A, there, and B, we're not going to fix it overnight. We've got to have a decades-long commitment to that.
Thank you.
Hello, Dr. Fauci. My name is Parth Mishra. I'm a sophomore studying healthcare policy and management in the School of Health. My question for you today is a commonality that I've noticed in a lot of your talks is this idea of how you've kind of pioneered your different fields through recognizing and addressing flukes, like the emergence of HIV or COVID that eventually escalated into global catastrophes. So how can we as a future healthcare member or a contributor, or even just as a society, become better at identifying and responding to these flukes? Does it require, addressing stigmas better, or a better surveillance system, or something else entirely?
Yeah, I mean, you should have confidence in yourself at your stage in your career that there is probably nothing that you can't do if you put your mind and your effort and your training to it. When I speak to students, mostly people who are interested in medicine, but I think it goes for any student, and I see that a few of you are from the School of Foreign Service, is that I was in your shoes. I was going to say not too long ago, but that would not be honest. a long time ago, and I felt the same sort of insecurity that you feel about how can I, as a person in my stage, have an impact on whatever field. Is, you've taken the first step, maybe not the first step goes back to, as Christopher was saying, maybe with your parents, which is with me, but you're in an institution now that is an institution that is really puts you on a pathway to be able to do the things that seem maybe difficult, if not unattainable. They're not unattainable, because I never imagined when I was at your stage that I would have any broader impact. And I didn't aim to have it, it just happened. So if you figure out what you want to do, get passionate about it, and work hard with it, very good things are going to happen. Because people ask me, is there anything you regret? Yeah. I mean, it isn't a regret, but if anything I have to do over again, I would worry less when I was younger.
Yeah. Remember that.
Thank you.
Thanks, Parth. We have time for maybe 2 more questions, and then we'll have to wrap it up.
Hi, Dr. Fauci. It was an honor to hear you speak tonight. My name is Kate Brower, and I'm a student in human science in the School of Health. I know we've spoken a bit tonight about the role of social media in spreading information, and I'd be curious to hear more about your opinion about Meta's recent decision to replace their fact checkers with community notes, and what you think this decision might mean for changing perceptions of the responsibilities of social networks and preventing the spread of disinformation.
Yeah, that's a great question that people right now, as you and I are speaking, are struggling with, because the going away from fact-checking was triggered by either the perception and reality, a little bit of each, that there was censorship of people who were saying things that were patently untrue. And if you want to hold to freedom of speech, you should allow people to say whatever it is that they want to say. And there is some validity to that. The only thing that I don't have the crisp answer to, but it worries me, is that when people say things that result in a deleterious effect on the health and maybe the lives of individuals, the removal of fact-checking is supposedly replaced by the other contributors to social media correcting that. Now, in my personal experience, there's a little bit of glitch in that, and this is only my opinion. I think it's right, but I'm not overly confident in it. That the people who spread false information seem to do it with a degree of energy that is greater than the energy of the people who are trying to get the truth out, because it seems that the people who are spreading disinformation don't have a day job. The only thing they do is spread misinformation. And then you have people who are in positions of responsibility. If they spent all of their time trying to correct the misinformation and the disinformation, they wouldn't be able to do what their primary job is. So it's almost like we're being outmatched by the disinformation people. And that's the reason why I tell younger people and students, don't be afraid of getting involved in the social media, of saying things that you can show by the data that you have that it's true. So it's a tough situation, because the Greek chorus of saying, well, if you tell somebody they can't say something, you're censoring them. Well, nobody's saying that you can't say something, but we have to have an equally powerful force of people who are telling something based on data to get out there and do it. But as I said a moment ago, the reason why that's tough is that those people don't have the time to spend all their time correcting disinformation. I know I don't. I don't. I have other responsibilities.
Okay, we have time for just one more question. My friend, the pressure is on. Make it good.
Those were all great questions, so I don't know how to top that. Thank you so much for being here. My name's Stephanie Vernoy. I'm a nurse by background and just graduated from the Clinical Quality Safety Leadership graduate program here. You talked about kind of that community healthcare with your father. I think one of the reasons we have burnout in healthcare right now is the drift from that. Any insight on how we get back there, or if that's even possible in healthcare today?
Yeah, well, we have a real problem with healthcare and healthcare delivery. You don't need me to tell you that. I think it really needs to be fundamentally changed. Sadly, the event with the tragic murder of the person who's United Health is unacceptable that happened. But I think it reflects by what the response to that was a dissatisfaction in what the healthcare system is. I believe, as many people do, that healthcare is a right for healthcare, not. And if your right is guided by your financial status, or whether or not you have access to insurance or not, then there's something really, really wrong with that. So I hope that somehow in the future that gets changed, and healthcare is something that everybody can get without, there are other countries. We're the richest country in the world. We have the best physicians, the best nurses, and our life expectancy is lower than most countries of our status. That's a fact that we really need to address.
Thank you for that question. Thank you. Dr. Fauci, this has been phenomenal. I want to just thank you for, again, being a part, choosing us, coming back here to Georgetown and making yourself accessible. You've been accessible to our students, to our faculty. You've just been so kind and generous with your time. And for that, we are thankful.
Thank you.
And thank you all for joining us this afternoon. To those of you who are attending virtually, thank you. And if you're attending the reception, you have to have the image that we sent to you via email. We'll see you downstairs. If not, have a safe trip home or wherever your destinations may take you. Thanks, everyone. Thank you, Dr. Fauci. Thank you.
Thank you. Thank you, Christopher. That was really great.